Hello and welcome you all to yet another episode of Get Smart with Your Heart series, World Heart Day special series organized by Integrated Health and Wellbeing Council and being powered by Boehringer Ingelheim. This series aims to generate awareness around cardiovascular issues, and today's discussion is on the topic of lifestyle, nutrition, and heart health. This session will explore the critical role of lifestyle choices, including nutrition, in maintaining heart health and preventing cardiovascular diseases, for which we have an expert set of eminent panelists here with us today. Please allow me to introduce Dr. Sameer Kubba, who is Director and Unit Head of Department of Cardiology at Dharamshila Narayan Super Speciality Hospital, Delhi. Sir, welcome to the show. Thank you so much for joining. I welcome Dr. Rajiv Chugh, who is consultant cardiologist at Railway Hospital, Agra Cant. Sir, thank you so much for joining. We are glad to have you on the show. With that, let us start with our discussion. My first question is to Dr. Rajiv. Sir, as physical activity is often emphasized in heart health, discussions, could you please elaborate on the types and durations of exercises that are particularly beneficial for cardiovascular health? Are there any special precautions that such patients should keep in mind while performing exercise?
Hello. Am I audible? Welcome all the participants and listeners. I am Dr. Rajiv. The physical exercises which are mainly done by a person is a high repetitive or the low repetitive exercises like endurance exercises. The mainly exercises which are beneficial for the cardiac patients or as an individual is the high repetitive exercises, which usually we measure in the terms of the metabolic equivalents, meaning the energy expenditure expended by a person during the exercise. So for the cardiac patients or a person having to prevent the cardiac disease, the person should have either the moderate intensity exercise or the high intensity exercises, which is defined as the metabolic equivalents term. We can define the energy expenditure less than 6 metabolic equivalents or more than 6 metabolic equivalents. In the moderate intensity exercises, there comes brisk walking as well as playing badminton by 2 players or cycling at. While in the high intensity exercises, the persons do the single badminton or swimming or playing lawn tennis as well as the biking with the more speed. So, as per the latest guideline, as per the ACCSA guideline, we should have either the 150 minutes of exercise per week of moderate intensity, or if a person is able to do the high intensity exercise, so it should be minimum of 75 minutes per week. It may be more.
Okay, so I believe there is some network issue at Dr. Rajiv's end. Yes, he is trying to join back. Dr. Rajiv, we can see you.
Yeah. There was some link breakage was there.
Yes, sir. Please continue.
So by any exercise, there is a decrease in the reduction of the cardiovascular risk, and something is better than nothing. So if a person is not able to do any kind of exercise, he should either do yogasan or some types of physical activity, which will definitely lead to prevention of the cardiovascular disease. So by seeing I would like to emphasize one more thing, that these kind of exercises helps a person to decrease the prevention of cardiovascular disease evolution, as well as increase in the life expectancy of the life, which if a person is able to do the regular exercises, there is an increase in the life expectancy in the terms of almost 5 years. It is adding to it. So by precaution which is to be taken by a healthy person or a person before any exercise, ideally better to get a health checkup done to rule out any congenital heart disease or any arrhythmias. Or if a person is healthy, so he can do any type of cardiac activity. But in case of already existing cardiac diseases, there are some precautions which they should consult to their respective doctors before doing any kind of physical activity.
Thank you so much, sir. My next question is to Dr. Sameer. Sir, we are, as our topic of discussion is lifestyle, nutrition, and heart health, let us talk a little bit about lifestyle as well. In your experience, what are the most common lifestyle-related factors that contribute to heart health issues, and how can individuals effectively address them? Over to you. Sir, can you please unmute yourself? Yes, please.
Yeah, so thank you very much, Dr. Sawant. I think it's very, very important for us to understand that we are going through an epidemic of coronary artery disease. By coronary artery disease, we mean blockage in the arteries of the heart, which can present as an acute heart attack or as an angina. And the most common conventional risk factors are smoking, and followed by high blood pressure, which is hypertension, diabetes. Diabetes is a silent killer, high cholesterol. And there are certain other risk factors which include obesity. And as Dr. Chug was mentioning about sedentary lifestyle, people not exercising, the concept of fast food culture, high calorie, dense energy foods which are easily available at the switch of a button by vendors like Swiggy, etc. The concept of having less of home cooked food, and the concept of having more of saturated fat and I would say packaged foods is increasing. Having said that, there are certain other non-conventional risk factors like air pollution, which also is known to increase the risk of coronary artery disease or heart disease. And the post-COVID issues are also another unconventional risk factors which are plaguing all of us. So post-COVID, we have seen an increase in the risk of heart disease and heart attacks. Having said that, I will continue the link given by Dr. Chug that exercise should actually not be done without proper guidance. And we have seen in last few months a lot of celebrities and people dying while walking on the treadmill or doing high intensity exercise. Now, what happens is that in young individuals and middle-aged individuals, they may have an asymptomatic blockage of 10 to 20%, 30% in the coronary arteries, which we call as plaques. Like you have dental plaques, you can have certain cholesterol plaques in the coronary arteries, and they are usually non-occlusive. They do not cause obstruction of the coronary arteries. But if they suddenly exercise, or if their blood pressure suddenly goes up, or if they are having hypertension or anxiety or diabetes, that plaque, which is non-occlusive, can suddenly rupture and cause the blockage of the arteries. So if you have any symptoms, or if you have risk factors, especially multiple risk factors, like if you're a smoker, if you are hypertensive, if you're diabetic, if you have a family history of heart disease, suppose your father or your maternal uncle or paternal uncle has had a heart disease before the age of 55, your risk automatically increases. So prevention is better than cure. And I think sudden unaccustomed exercise should be avoided. And one must know the risk factors, which can be conventional, which I said 5-6 risk factors. And there are certain other non-conventional risk factors, which are also important.
Thank you so much, Dr. Sameer. We will discuss that more in detail with you. But my next question is to Dr. Rajiv. Sir, there are so many misconceptions that are running around heart health. Many people do not know that having a blood pressure is a very normal terminology. Your blood pressure being high or low than the normal range is an abnormality. At the same time, other misconceptions such as you should not do Shirshasana or reverse poses if you are suffering from some sort of heart diseases or blood pressure issues. So how many of them are true and how many are just myths? Can you please share some common misconceptions regarding heart health and nutrition around heart health that you inquire in your practice, and how can those be addressed? Sir, can you please unmute?
Yeah. There are various misconceptions which are prevalent in the societies. Like one of the common misconceptions was to take the alcohol, which is beneficial to the heart, which we were also aware that moderate amount of alcohol is actually beneficial to the heart. But nowadays a conception has arrived that any amount of alcohol is bad to your heart or your health. So there are certain other misconceptions also. So like red wine or chocolates are good for all, but these are not true. Similar type of misconceptions are like low carbohydrate diet or low fat diet is actually good for the heart. But eating a good right amount of food is more important rather than having the low carbohydrate or low fat diet. Like in the fats, we can replace the saturated fat with the polyunsaturated MUFA or PUFA oils. So, or with along with the beans as well as seed oils like olive oil or virgin olive oil. Or if you want to cook at the higher temperature, we can have a extra virgin olive oil or highly oleic acid palm oil. So these kind of things to had a good good amount of food and with the right food, that is more important rather than having the bad food and in the moderate amount or in the less amount.
On the same note, sir, there are so many people who really fear consuming fats, that is, good animal fats for that matter, whether
Yeah.
it may be white butter or clarified ghee for that matter, and feel that that would be bad. So they go for alternatives, which are synthetically made plant-based butters, etc., which contains lots amounts of ingredients, synthetic chemicals, as well as preservatives, etc. So what would your suggestion be when it comes to people when they are choosing options, healthier options, specifically to protect their heart health? What would be your
I,
suggestion?
I would specifically suggest, as I already mentioned, that any kind of processed food or a highly plant food should be avoided. That usually contains the diet less rich in fibers. So it's better to we can have the different type of oils, and better we can have the alternative of these kind of oils. So we can have the all the quantities available. We can have alternatively. Like 1 month we can have coconut oil, or 1 month we can have safflower oil or safflower oil. So we can replace them monthly. So that will be beneficial to our health.
Thank you so much, Dr. Rajiv. My next question is to Dr. Sameer. Sir, there is a running fear amongst people when it comes to getting their heart checked. They feel that if they were to go and see a specialist and get their heart checked for any of the pain that they are suffering or any of the symptoms, the heart specialist would detect them with some sort of blockage for which some surgery would be required. So in our experience with other interventional cardiologists and cardiologists, it was highlighted that people really fear in going and seeing a doctor, especially a heart doctor. So how have that experience been in your practice? Have you experienced the same? And if so, then what advice would you want to share with the audience that are watching?
I think one must understand that we are now having a lot of atypical presentations of heart attacks. So like you see in movies, पिक्चरों में दिखाते हैं कि छाती में दर्द हुआ and they come to the hospital. Most of the times this doesn't happen. And there is a category of patients who will have atypical symptoms. And that would be elderly patients who are not able to express themselves well. They have associated issues like some neurological issues, some gastric issues. So they may actually feel that possibly these symptoms are because of aging or other issues. And they may come to you very late. So recently we had a patient who actually was having some gastric symptoms and some symptoms for about a week or so. And his son was actually very busy in his work. And when he actually deteriorated after 7 days, he came to us in a condition of shock and heart block, and we did his emergency angioplasty. So that is one category of patients who have atypical symptoms. The second category are women. They will not have typical symptoms of heart disease, although women are protected to a great extent because of their hormones. But we are also seeing now increase in the heart disease in women thanks to obesity, sedentary lifestyle, extremely stressful I would say, professional conditions, etc. Third is the patients who are diabetic. So diabetes will have silent heart disease. They will not have chest pain because the nerves are damaged in diabetes. So diabetic patients may present to you for the first time with a heart failure I would say, a silent heart attack, or maybe a kidney failure or a stroke. And the fourth category of patients are young patients. They actually feel they cannot have a heart attack. But we are seeing a reverse now. We are seeing more and more of young people coming to us with heart attacks. When I was doing my training and when I was going to school, we actually never heard of young people coming to us with heart attacks. And in my initial training days, I saw sons bringing their fathers with heart attacks, but now we see fathers bringing their sons with heart attacks. So it is not uncommon to see heart attacks in young people, especially in India. About 25 to 30% of the heart attacks will occur below the age of 40, and about 40% may happen below the age of 50. So preventive health checks become important, especially if there are risk factors. And the risk factors are, as I mentioned, hypertension, diabetes, smoking, a strong family history of premature coronary artery disease. Somebody in your family, suppose your father had a heart disease before the age of 55, or your mother had the heart disease before the age of 65, you automatically become a high risk because of your genetics. So you must be tested in such scenarios. Recently, there was a patient who came to me after having a heart attack in UK. So he was actually exercising on the treadmill, and he just had a chest pain. He did not have any conventional risk factors, like he was not a smoker, non-alcoholic, non-diabetic, non-hypertensive, good at doing exercise. And while doing treadmill, he suddenly collapsed, and he went to the hospital, and he had a major heart attack and was stented with 2 stents in the coronary artery. He was visiting India, so he came to me. And when I took his history, the only risk factor I could gather was that his father had a heart attack at the age of 55. And he lived for next 10 years, but he had 3 or 4 heart attacks. So he died at the age of 66. So had this been known to the patient and also to his treating doctor, they could have actually tested him for cholesterol, or maybe done some non-invasive testing in the form of a stress test, or maybe a CT coronary angio, whatever. So you could have picked up disease early. So the fear that if we go to a doctor and the tests will be ordered and we'll find some disease is unfounded. And even if you find disease, most of the times early disease can be prevented from progressing. It can be cured. It can be, I would say, it can be a silver lining on the cloud that at least now you know you have something. You will become more cautious about your health. So in fact, certain studies have shown that if you are tested and if certain tests show certain borderline abnormalities, maybe in the long term, your mortality decreases because you are more cautious about your diet, you are more cautious about your exercise. And maybe if you have high cholesterol or things like that, you can be given certain drugs like statins, which can stabilize your plaque and prevent the progression of disease. So मैं ये कहना चाहूंगा कि fear ना करें. Fear करके कि मैं जाऊंगा और मुझे ये problem निकल आएगी, इससे पहले कि you land up in an emergency situation, if things come to the fore early, you can actually be treated early, you can prevent your disease from progressing. It is very disheartening that at times without education and suddenly the patients will have symptoms and they have a heart attack and their heart pumping becomes low, or heart becomes, I would say, LV dysfunction, which we call in the medical terminology, is permanent. So if you come early, if you are treated early, if you are picked up early, and your disease is treated before your heart failure or your heart muscle is damaged, you can actually lead almost a normal life. So don't fear that if you go and you have a test and if there is some problem. If you have symptoms, and community education becomes very, very important. See, knowing your risk factors. If you have multiple risk factors, you definitely must be tested. If you have minor risk factors, it is not necessary. And maybe doing a test which is absolutely normal and you don't have any risk factors, you can repeat the test after 5 years. It is not essential you do it every year. Yeah.
Sir, on the same lines, we wanted to know from you that now that you have emphasized that people of younger age groups also are getting heart attacks at a very, unpredicted age. And those who have genetic history of heart attacks or any cardiac problems also are suspected to get it because of genes. So what would be the screening and diagnostic advices? At what ages should such people go and get a precautionary check done of their heart health and its condition? One, those who do not have any genetic predisposition of cardiovascular diseases, and two, that have some sort of predisposition or running in their family. What would be your advice?
So that's an excellent question, and there are no clear-cut guidelines. The one of the guidelines from the United States actually suggested that patients who have a history of premature coronary artery disease in their family must be screened by the age of 20. Now, let me tell you, my youngest patient whom I did angioplasty for was 18 years of age. And we are actually seeing patients in the age of 40 and 50 quite commonly having heart attacks. Still, heart disease is actually a disease of the elderly. Most of the disease occurs after the age of 60, but in India, it happens 10 to 20 years earlier as compared to the Westerners. So although there are no clear-cut guidelines, but screening for blood pressure must start even in schools, because obesity is increasing in the children. And maybe the first time they must be tested for the blood pressure latest is by the age of 18. Patients who have a history of premature coronary artery disease, maybe at the age of around 20 or 30, depending upon the clinical scenario. But if you have no symptoms and if you're absolutely fine, I would say around 35 to 40 years of age, you must be tested. See, hypertension is a big killer. We are seeing patients in the age of 25, 26 having high blood pressure. 1 in 3 individuals in the country has a high blood pressure. So you imagine the kind of problem which we are dealing with. The example which I gave to you about familial hypercholesterolemia, or a disease which runs in families, this patient was 42 years of age, the patient whom I described to you, who came to me from UK after having a heart attack. So this patient was just 42 years of age. So if he would have been screened at the age of maybe say 35 or 40, even that his father had a history of heart disease at the age of 55, maybe we could have prevented the heart attack. I'm not saying we could have prevented the coronary artery disease. We could have prevented the heart attack. He could have been initiated on a good, healthy lifestyle and maybe certain drugs like statins to prevent it. Having said that, the second important point is not only genetics. There are shared lifestyle risk factors also. So you cannot blame everything on genetics. You may have a genetic tendency, but that is non-modifiable. But what is modifiable is you can have a healthy diet, you can have a healthy exercise pattern, and this person is now concerned about his children who are 7 and 8 years of age. So they are also at high risk. His brother is 51, his sister is 56. So they are also at high risk. So they must be tested at least with the basic tests, maybe cholesterol levels, maybe a stress test, or maybe even a CT coronary angio or a calcium score. So I would say there is no clear-cut guideline, but if you have a strong family history of premature coronary artery disease, maybe around 30, 35 might be the good age. If you don't have any risk factors, maybe around 40. But screening for your blood pressure must start at the age of around 18, maybe even in school obese children also.
Thank you so much, sir. I will come back to you on two points regarding shared lifestyle risk factors and necessity in India around developing guidelines that are specific to Indian, conditions around heart health that we are following. But one of the questions that I would want to know from Rajiv, sir, first is, sir, do you feel that this early predisposition of people getting cardiovascular issues is due to the ongoing and increasing stress? Is it corporate stress that we are facing? Is it lack of sleep, or anything that this current lifestyle that men and women are following is somehow somewhere affecting it or aggravating their heart conditions? Is it that? What, in your opinion and observation?
Yeah, actually, this is a multifactorial, basically predisposition as well as causative factors. Like stress, number one thing. Number second is the expectancy from the people. So we all are in the peer pressures that someone is earning this, someone is doing like that. So the people are having so much stress by this, and work pressure stress, the target stress, along with the like recent COVID also causes a lot of stress physically as well as mentally as well as by health. So people are having inflammation in their arteries. So on adding to it, the most of the people are having polluted these cities. So these all the causative factors which are adding up, which are leading to the premature onset of the coronary artery disease, which itself leading to the heart attacks. So giving a credit to a single factor, this is not possible. But we are having a multifactorial etiology. So it is causing the premature onset of the coronary disease, especially in the people like 18 years are also having, like the sir has said. In one of my duties in Max, I have encountered at least 4 people who were from 18 to 25 years of age, and all were having the non-ST elevation MI, which we were able to pick it up. And even we are not able to stand one person, so he has to undergo coronary artery bypass grafting at the age of 25 years, and he has just married 6 months back.
That is very sad to know, sir. And also the incidences that Dr. Sameer described were also alarming, that the patient coming for a heart attack being, even 18, less than 18 years of age. I wanted to know from both our experts that is the scenario similar for younger women as well, or do the stats and numbers vary when it comes to younger women getting cardiovascular diseases? So starting from Dr. Sameer.
Yeah, so women are relatively protected. So because of their hormones and because of their overall milieu, they are protected from cardiovascular disease. Now, the women who must be extremely careful at a young age are the women who are diabetics. So a diabetic woman has a high risk. And about 4 days back, I had this lady who is 42 years of age, heavy diabetic, and came to us with a delayed onset of a heart attack. And by the time she was with us, her oxygen levels were down, her heart was failing, and she did not have any chest pain. And she had gone to some wedding, and she was ascribing her symptoms to gas because she has some gallbladder issue also. And she had a major heart attack. We had to stabilize her for 2 to 3 days before even doing a coronary angiogram. And when we did the angiogram, she had blockages in 2 arteries, and we stented that. And what we found was she had a very high cholesterol. Her father had died at the age of 55. The mother had died at the age of 57. So she was a diabetic and she did not know anything. And she was just ascribing her symptoms to non-cardiac. So what I'm trying to say is that women are not immune to coronary artery disease, and some of the younger women may have non-atherosclerotic, the usual coronary artery disease because of cholesterol and atherosclerosis. Sometimes you can have because of inflammation, like aortoarteritis. You have certain connective tissue disorders in which there may be inflammation on the coronary arteries. But overall, the incidence of smoking is less in women. Their hormones protect them. The risk is less. But obesity is increasing. Some of the women may be taking oral contraceptive pills, and we have seen the increasing incidence of smoking in young women. So the incidence is increasing. Some of the malignancies and breast cancers are also increasing in women. And one of the markers for premature coronary artery disease in women is breast calcification. So women may have relative protection. We see more of young men coming with heart attacks. We rarely see young women. But we must understand that over a period of time, men and women are having similar sort of professional cultures, similar sort of, I would say, demands at the workplace. And for a woman to handle things is much, much more difficult because she has to handle family as well as her profession. So they are thankfully protected because of their hormones, but the scenario may change fast. And the symptoms in women are very, very atypical. They may not have the typical symptoms. So cardiovascular disease in women is again something which we must actually look at very, very seriously. Overall, in the world also, the kind of treatment which the women get from cardiovascular disease is not as good as what men get. So there are a lot of gender differences. But overall, yes, they are protected, but the incidence is increasing because of the factors which I have discussed.
And if women are suffering from obesity or stress, then definitely it does aggravate, as we have understood. My next question is to Dr. Rajiv. Sir, are there any specific dietary recommendations that you would provide to individuals aiming to improve their heart health, apart from like the oils and selection of products that we have discussed? Are there any particular nutrients or foods that should be a part of their diet to protect them from, any upcoming heart conditions, as many people are just interested to know कि हम ऐसा क्या खाएं कि हमारा heart healthy रहे? So can you please touch upon that?
First of all, I will like to emphasize to avoid what foods they should avoid. Like they should avoid the processed food, as well as the spicy food and the fried foods, which are mainly adding to the outside food they should avoid, and along with the alcohol. And in the right dietary advices for them, that they should have a balanced meal, which should contains at least 20 to 30% of the total calories as a fat, and out of fat it should be 7 to 8% of the fat should contain the saturated fatty acid, while rest of the calories by the MUFA or PUFA, means multi-unsaturated acid or unsaturated fats, while the trans fat component should be less than 1% or minimum. And in the carbohydrates form the 40 to 50% of the diet, and it should be mainly coming from the vegetables, beans, all the whole grains, which should be high rich in the fibers. And the green leafy vegetables should form at least the 5 to 6% of our daily diets. And there are various kind of diets which are advised in the cardiac patients, like Mediterranean diet or the DASH diets, which are having a good effects and proven scientifically. And if we add in the Mediterranean diets, if we supplement it with extra virgin oil or the nuts, then it becomes a good for the patient for the prevention of the cardiovascular disease. These diets can be accessed on the net or something like Dash Diet Organization or something. They can access from this. And most of the diets are having the 5 to 6 servings of the balanced diets, along with 2 to 3 servings of the snacks.
Thank you so much, Dr. Rajiv. My next question is to Dr. Sameer, from where we left off in the previous question. You spoke about shared lifestyle risk factors. So, sir, for our audience to understand better, can you please touch upon what it means? And also, what are some of these risk factors that you're talking about?
So, I actually use the term shared risk factors, especially in association with patients who have familial hypercholesterolemia or a familial history of premature coronary artery disease. So what happens is they definitely do have a genetic component to it, and they would say that I am at a high risk because my father had a premature coronary artery disease or my mother had it. But what we see is it's not only a genetic aspect, it is also a lifestyle which they commonly share. So if you see in families, if parents are obese, the children will also be obese. If you see in certain families, suppose somebody is very, very health conscious and he's moved to a different city, one brother may be thin, but the other brothers may be obese. And similarly, their children will also follow the same pattern. So if you tell your patients that, or if they feel that I am having a high risk because of my genetic factors, they would not look at their shared lifestyle. What I try to say here is genetic factor is non-modifiable, but your diet, your exercise, all these things can be incorporated early in life. So these patients may not be motivated to follow these healthy lifestyles, and they may just put the blame on the familial history, which is not right. And it has also been seen that if the spouse comes to this family from some other family, he or she may be genetically protected because she doesn't have the genetic tendency, but because of the lifestyle they commonly share. So if the husband is obese, there's a tendency for the wife also to be obese. They actually take the same kind of food. The children take the same kind of food. And we are more influenced by our maternal choices of food. So if your mother is cooking a particular type of food, the chances that you are following your mother is high. So shared lifestyle is something which you share in families. Lack of exercise can be shared in families. The kind of, I would say, non-healthy diet can be shared in families. Vis-a-vis exercise may be shared in families. All the children and the parents may be exercising well. They may be cautious about their diet. So your lifestyle becomes very, very important. And you would have seen that it runs in clusters. Friends of exercise oriented people are actually more motivated, and they have similar sort of company, while obese people may have company of obese people. So it's very, very important for you to understand and choose your company, because that makes a difference. And that is something which is modifiable. Genetic factors are not modifiable, but you can control your blood pressure, you can control your diet, you can control your walking, you can control your exercise, you can control the portion of the fruits and vegetables which you are having, you can control the amount of sleep you are doing, you can control the yoga you are doing. So there are so many things which you can control. And even despite that, if you have a coronary artery disease, you are unlucky. But again, I would say, on a background of a familiar or a premature coronary artery disease, to become more cautious from an early age becomes extremely important.
Thank you so much. We completely understand what you mean now. So thank you so much. With that, my very last question to both our panelists today is, we discussed the recommendations, that guidelines for getting screened for all sorts of heart diseases, as shared, that there are no particular age guidelines as such, the way we have for other diseases such as gynecological cancers, etc. Would both our panelists feel that there is a necessity for the government to, come out with some sort of strict guidelines for early screening, early detection amongst all populations, who come under this, age range of say 25 to 50 years in between, so that we can at least mandatorily screen for cardiovascular diseases as a touch point for everybody, so that if anybody who is unaware that they might have some sort of atherosclerosis in future, or blockages in future, or any symptoms that are hidden for now, can be brought into light for them. What do you feel about that? Would this be important? Should the government work towards it, or how do you feel? Starting from Dr. Rajiv.
Yeah. Actually, our is a government setup. So railway is a very robust system of healthcare system. So we are already having the certain kind of guidelines for especially the high risk staff which are having in the train operations, like loco pilots and the guards. For them, we have already established the guidelines, like periodical medical examination for them is done routinely. Like for up to the 40 years is done every 4 years, and then after 40 years we do usually at the interval of 2 years, which includes all the parameters or whatever the examiners the things or suggest, they are being done free of cost for them. So by we already prevented the occurrence of the heart disease, as well as the initial stage पर ही उसको पकड़ के we do the treatment of them. And if they are not able to carry out the train operation, we remove from them and fit them into the other job. For the less risk, those who doesn't directly involve in the operations, we are having the guidelines for 4 years after the age of 50. And for the railway protection staff who needs the high risk of physical activity, we are doing 6 monthly their health checkup camps for them. So these can be applied to the generalized population also. That will be good for it. But for them, the major factor will be the money. So that is the main thing which we have to take care of.
Dr. Samir sir, what are your thoughts? As Dr. Rajiv shared the scenario in railway hospitals, which are medically advanced, equipped, etc., are prioritizing on this aspect. How is the scenario like for those who do not belong to, railway sector, general public?
So I think to do it at a population level for everyone and everybody is just not possible. not only about financial aspect, but it's just not possible to screen, and it's not logical also. But yes, if you are in high-risk jobs like railways or pilots and people who actually are responsible for lives of so many people, so in them definitely. And second point is what we call as opportunistic screening. So if a patient is coming to the hospital, and like I mentioned about premature coronary artery disease, so somebody who's come with a heart attack or a heart disease at the age of about 40 or 45, it would be a good opportunity to make a note of this patient and screen all his family members. So that is something which we can do once a disease has happened. But it's more important, I would say, is to educate the community. And I think we are blessed in the scenario of social media, information technology. Everybody has a smartphone now, even in the rural areas. So I think information and education is very, very important. And the most important thing is, what are the healthy heart behaviors? As I mentioned in the initial part of my talk, the 4 health behaviors and 4 health parameters. These are very, very important. So eating right, exercising, having a good body weight, good sleep, maintaining your cholesterol, sugar, BP, etc. under check, that becomes very important. And this is very, very easy. I think this we can put it across. And now we are seeing more and more of the people getting educated about it. There are also certain calculators available online which are known as atherosclerotic cardiovascular disease risk factor calculator, ASCVD. So you can go on your smartphone, type your age, your sex, whether you're a smoker or no, what is your cholesterol level, are you diabetic, yes or no, what is your blood pressure. That will give you a rough estimate that what is the chance of you having a heart disease in the near future of next 5 to 10 years. So if the risk is high, see a specialist. If the risk is low, just concentrate on your diet and lifestyle. And let me tell you, aging in itself is a disease. Most of the times our body takes a lot of our whatever stuff we are doing till the age of 40, 45, but then you realize that you have been not very careful with your body. You have been busy in your training, in your profession, and when you have gained some of the things in life, you suddenly now realize that your health is going downhill. So my suggestion here, and my, I would say, opinion or message to all listening here is to become commandos actually in telling each and every person in and around you, one person telling the other person, the second person telling the third person, that how we can actually have a healthy behavior in our basic things like diet and lifestyle, and be not afraid of preventive checks, especially if we have risk factors. Be not afraid of screening, because if you pick up things early, you can treat them early. Even cancers, if they are picked up early, you can be cured for the lifetime. The biggest problem with cancers is they are diagnosed late, and by the time they are diagnosed, the problem has already happened. So you can have silent diseases of, I would say, malignancies or cancers or silent heart attacks. But if you know the symptoms, if you know your risk factors, and if you're educated well enough, I think we'll go a long way. I think education is the biggest weapon. Education is the biggest empowerment. And I think programs like this can help our viewers understand the importance of education. And this must go on.
Thank you so much, sir. We will be taking key takeaway messages from both our speakers. Dr. Rajiv, sir, your key takeaway message for the World Heart Day series that we are doing for all the audience that is watching. Sir, Dr. Rajiv? Yes. Are you able to hear us? If you can please unmute yourself.
Yeah.
Yes. So your key takeaway message for the World Heart Day series for all the viewers that are watching.
Like we have discussed and Sarah said that we should be conscious about our health than ourselves, and the basically health is our right. We should understand this and we should work for this. So we should have eat right, exercise right, and whatever things you want to do without less stress in your life. You cannot achieve each and everything. We should understand this, and whatever we have limited resources, we should work in this with our good, healthy mental well-being.
Thank you so much, Dr. Rajiv. Dr. Sameer, sir, any key takeaway message for the audience that is watching for the World Heart Day series?
I would say health is wealth. Prevention is better than cure. And bachpan mein we were taught quotations like early to bed, early to rise makes a man healthy, wealthy and wise. An apple a day keeps a doctor away. So मैं कहूँगा कि इनफैक्ट साइंटिफिकली अगर हम अपनी ट्रेडिशनल चीज़ों पे चले जाएं और अपनी हेल्दी स्लीप पैटर्न को रखें, अपना खाना पीना एक नॉर्मल इंडियन थाली जिसमें फ्रूट्स होते थे, वेजिटेबल्स होती थी, चपाती होती थी, जैसे डॉक्टर राजीव ने बोला कार्बोहाइड्रेट, फैट्स, एवरीथिंग इन मॉडरेशन एंड इन द प्रॉपर क्वांटिटी is a very good balanced diet. So I think we must actually see and understand why are the heart attacks now increasing in young people. What has suddenly changed in last few years? It was not happening before. So something has gone wrong, and I think our diet has gone wrong, our sleep patterns have gone wrong, our exercise is not there, we are sleeping late, we are on our mobile phones, our sedentary lifestyle is there, and I am very, very worried about our younger generation who is actually now more so glued to their mobile phones, sleeping late at night. So I think we have to work just on the basic strategies. If you are able to do that, I think probably we can actually have a great reduction in the heart disease. Stress, as you mentioned, is a very, very major risk factor. Stress was less in the previous generations because of certain factors. They were more stable in their jobs, in their profession. Nowadays, there's a lot of stress which is happening, and people are not socializing. People are sleeping late. Or I would end by saying, be more social, keep on meeting your friends, have your connections which are beyond your profession, do things which your hobbies are so that you feel happy about it. और कहते हैं कि खोल दिया होता दिल अगर यारों के संग तो आज ना खुलवाना पड़ता औजारों के संग. So I would say that be in touch with your friends and your family and people who make you feel good and happy, and have a balanced life about your work, your profession. That is very, very important. Health is wealth. अगर health नहीं है तो फिर कुछ नहीं है. तो आप prevention करो, अपने preventive checks जहाँ जरूरी है आप करवाओ, and establish the balance in your life, and you are the owner of your life. You are the best judge what suits you and what doesn't suit you, and what works for you and what doesn't work for you. So don't be under any peer pressure, as Dr. Rajiv Chuk said. See yourself, recognize yourself, and don't be worried about going to your doctor and asking him questions or taking care of lifestyle. I think there are a lot of information now available on the internet and on programs. Don't use that excessive information. Use that balanced information, and just follow your balanced lifestyle of healthy eating, exercise, sleep, and preventive checks. Thank you.
Thank you so much, Dr. Sameer. Sir, we are brimming with happiness and encouragement after hearing you, and also with lots of knowledge after hearing Dr. Rajiv. Thank you so much. With that, we come down to the end of a very insightful, very interesting session for the World Heart Day series on Get Smart with Your Heart, an initiative of Integrated Health and Wellbeing Council being powered by Boehringer Ingelheim. I would like to thank both our eminent panelists for taking out time from the busy schedule for imparting wealth of knowledge and information. Thank you, Dr. Sameer Kubba, Dr. Rajiv Chuk. Thank you so much. At the same time, we would also like to thank our partner, Boehringer Ingelheim, for partnering up on this brilliant initiative of Get Smart with Your Heart for raising awareness around cardiovascular health for the World Heart Day series. Thank you so much. Lastly, we would also like to thank all our viewers for staying with us till the very end. With that, we sign off now. Stay happy, stay healthy. Bye-bye.